Welcome to Ellevate Louisiana's Health and Wellness Policy Committee meeting. I'm Julie Stokes, CEO and founder of Ellevate. Today, we're joined by Jaqueline Cooke and Dr. Rebecca Hook to discuss the Whole Health Louisiana initiative and get a checkup on its progress and its future outlook. Jaqueline Cooke is an advisor with Trepwise, where she helps lead strategic projects through thoughtful research, facilitation, and collaborative planning. She co-designed and facilitated the development of Whole Health Louisiana plan. And so now she supports the statewide trauma-informed care trainings alongside the Louisiana Department of Health and the Blanco Public Policy Center. It's a lot of busy things you have going on there, Jaqueline. But Jaqueline's background spans the tech startup, nonprofit, and public sectors, and she's a graduate of Tulane University. Dr. Rebecca Hook serves as the first Director of Medical Services for DCFS's Child Welfare Division, bringing years of experience as a pediatric emergency physician at Our Lady of the Lake and the Lady of the Lake Children's Hospital. She established the SAFE clinic for pediatric sexual assault victims and now works to strengthen medical standards, bridge child welfare and healthcare systems, and improve outcomes for vulnerable children across Louisiana. I can't say enough how meaningful and difficult and important that work sounds, for sure. So Jaqueline and Rebecca, thank you for joining us. We're excited to hear more. So I think what I'm doing today is turning it over to Jaqueline, and she is going to go ahead and start us with an overview and an update on Whole Health Louisiana.
Awesome. Thank you so much, Julie. And thanks everyone for having me. I am really excited to get to talk to you all today and share out about the Whole Health Louisiana initiative and the statewide plan that we developed and have been implementing for the last year and a half now at this point. The creation of Whole Health, the initiative, and the plan was really collaborative, and we're really focused on both kind of like wide reach grassroots approach as well as really meaningful change from that systems perspective, which of course, as we get later into the plan, really will come into that policy space. So really just excited to be here and be able to talk to you all today. I do have a number of slides, so I'm going to go ahead and share my screen so I can kind of walk y'all through the background and progress to date. And if you have questions throughout, I think feel free to just drop them in the chat and I will answer them to the best of my ability. But as Julie mentioned, I am with a strategic planning group out of New Orleans called Trepwise. And we've been working really closely with the Louisiana Department of Health for the last 4 years to work on this initiative. So it's really been a group collaborative effort. All right, so Whole Health Louisiana. Y'all may be, pretty familiar with the initiative. If not, I'm going to give you lots of background information. But really, this is Louisiana's statewide plan to systematically address the issue of childhood adversity and trauma. If you're interested in kind of going more into the details after my presentation, this QR code will take you to the website, but I will also have it at the end of our presentation. So really just to give some background on how we got to this point, a number of folks kind of came together years ago, some folks from LDH and others who are experts in the space when it comes to family and child health and well-being, and really wanted to understand what is the current state across Louisiana for how providers, families, community members, leaders are experiencing childhood adversity and experiencing, the prevention or mitigation of that adversity and trauma. And so we were brought in to really do a pretty extensive discovery. So it was about an 11-month process where we, had interviews with different experts from community organizations and state agencies, as well as a community survey that went out and was filled out by around 700 people. So we could really understand, okay, what is working really well across the state? What are our forces for change? And then what are our big barriers or gaps and being able to provide resources, services, prevention, anything that can benefit the health outcomes for people of Louisiana. That discovery report is on the website as well. So we went through this pretty, comprehensive discovery process. And then once we developed the report out of that process, we held a state leadership convening in I guess, yeah, it was November, the end of 2022. And we brought together, again, a bunch of state leaders, experts, advocates for this type of work, where we could go through the key findings from the discovery report and start to lay out the foundation for the plan. So align on a vision for our state for the future and start to understand what would be important for planning process. We then had almost a year-long planning process following that convening, where we had a number of different stakeholders involved. We had a business advisory group, youth advisory group, steering committee, working groups, tons of different folks across the state who were really able to lend their expertise to take what we learned from Discovery and turn that into actionable, feasible objectives that are listed out in our whole health plan. And again, that plan's on the website. But to give you the high level, the big mission of our plan is to transform Louisiana's approach to cross-system collaboration and community-specific care so we can prevent, recognize, and treat childhood adversity and its effects, allowing everyone in our state to access their full potential. Our big vision for the future is that children, families, and community members across our state are healthy and thriving regardless of who they are or where they live. So really wide reaching, because, even though we're really talking about childhood trauma and adversity, we know that this is a community level issue. It affects you, into your adulthood and life and therefore, your family and community around you. So just at a high level, I'll kind of touch on the key parts of the whole health plan. We have four key priority areas. I won't, read each of these out in too much detail, but our four key areas, just so you kind of have a sense of where the focus is. The first is all around collaboration. I think you all are very aware of how important this is. This is really like the cornerstone of the plan is focused on collaboration. And as we were going through plan development, we realized we really need to ensure that the collaboration that's been present through the planning development continues on as part of the plan. Because we heard so much in Discovery how areas are siloed, people aren't learning from each other, there's not, shared funding or shared impact. And we just, see how big of an opportunity that is. Awareness is another big goal, both at kind of that like higher decision maker legislator awareness level, but also that like grassroots, just community members, anyone who's in like a child or family serving role, spreading that awareness. Prevention and healing, of course, prevention is, like hugely important and one of the most impactful ways to kind of move the needle in this area and with these issues. But of course, also focusing on the healing. So making sure there are services and resources that are accessible and that exist, that can both focus on that upfront prevention and then also that back end healing. And then our final priority area is all about workforce. A huge amount of what we heard through our discovery was that, I'm sure y'all have heard the phrase, you can't pour out of an empty cup, right? And our service providers are at capacity. They're facing burnout. They're not always in the highest paid roles. And if, we want the people who are receiving services to be able to heal, we really need to make sure we're also taking care of the workforce who's taking care of them. Okay, so I'm going to touch a little bit on our coalition. Just as I said, that really is the backbone of this plan. So we do have a coalition that meets every other month. This includes community members, service providers, leaders, subject matter experts. And again, this is kind of twofold. We have a coalition to support with the implementation of the plan, but the existence of the coalition is also really part of plan implementation because we make sure we have this space for connection between folks who are in similar roles but are across the state, that we're, fostering those opportunities for collaboration. We share out different events that are happening or resources or learning so we can foster kind of, that ongoing collaboration, shared learning, and then in the future, hopefully also shared funding and shared accountability as we get more into data and evaluation and more into long-term funding. The coalition is kind of just one piece of our structure for implementation. So you can kind of see how all of our different levels interact with each other to have an overarching leadership structure. We do have a dual leadership model. So we have LDH as kind of our public sector backbone, and then we have the Blanco Center as our statewide implementation lead. We do have our broad coalition membership as well, and all of those directly interact. Our initial thought was to have a coalition steering committee. Where we're at right now, we have kind of instead just tiered coalition members. So we have guiding members who are, willing and able to provide more expertise and time to support implementation. So we haven't enacted a steering committee yet, although that may come in the future. Like I mentioned, we do break out our two levels, our participating members and our guiding members. So everyone, is invited to and expected to attend our coalition meetings and kind of spread the word about our initiative. But then guiding members help us with some of that additional lift of having kind of like work session meetings to advance certain parts of our priorities. In the future, we're looking for support with grant identification, connecting us to their communities, speaking on behalf of Whole Health. So really kind of more targeted support there.
Yeah, and just FYI,
Yeah.
Ellevate is one of the participating members, and we kind of joined
Yeah.
in early because we saw how important this work is going to be. So thank you.
Absolutely. Yeah, and I mean we're always looking to grow. So, it's not an exclusive coalition. We know that this work aligns so closely with so many different organizations across the state. So we're always looking to grow that participating member base. All right, so you've kind of got the background, the history. Hopefully that wasn't too repetitive. I know that it's some stuff y'all may know, but as far as our plan progress, so like I named, we are in the middle of our year 2 implementation right now. We're about halfway through year 2, but I can just touch on some of our progress for year 1. So the entire plan across those 4 key priority areas that I named have 32 objectives kind of nested within and across those 4 priority areas. So there's been a good bit of progress across most of the objectives outlined in the plan. Some will come into play later. I don't know if I named up front, but this is a 5-year plan. So we are still towards the beginning, but we're getting towards that kind of midpoint. So we're glad to see some progress, but of course, a lot of things are still being advanced as we go through our implementation. As far as year 1, we had a few different implementation activities. We do lunch and learns every month. Some of y'all may have attended those or seen those in our newsletter. So we are still doing those the second Thursday of every month. In year 1, we were also doing regional trainings. So we held a training in each of the 9 regions of the state that was just focused on like the foundations of trauma-informed care that was targeted mostly towards professionals in child and family serving roles, but it was open to community members as well. And then, of course, we had our coalition meetings and then 2 semi-annual summits, which are similar to coalition meetings but open to the public. So we're continuing a number of those through year 2, especially the lunch and learns and coalition meetings. And for our first year, we had a pretty good turnout across all those events. We had 430 attendees. We offer continuing education credits for lunch and learns and regional trainings. And we've just been doing a ton of outreach to different organizations to build that membership base. We have a lot of different Lunch and Learn webinar topics. So this is something, if folks are interested in specific topics, you can always reach out and let us know. But we kind of seek out folks, whether they are members of our coalition or just folks that we're familiar with in the ecosystem, to have about an hour virtual session where they can speak to an area of expertise that's relevant to our mission and to the work that our members do. These are also open to the public. Which then brings us into our year 2 activities. So again, we're about halfway through year 2 right now. So we have some kind of key strategies that we're focused on for year 2. We're looking to deepen our workforce development in alignment with that priority area. So finding some key areas we can support that child and family serving entities. We're looking to expand awareness, so promoting trauma-informed care more broadly across the state, engage folks through training, so continuing with Lunch and Learns and having some general trainings. We're not doing the 9 regions again, but we are planning to have some virtual sessions with the same topic areas covered. And then finally, really strengthening our coalition even further. As far as our deepening workforce development strategy, we're excited that we are launching Whole Health Louisiana's Thrive at Work. This is a pilot in partnership with the Center for Children and Families up in Monroe, and they are in the middle of developing a pilot program to, again, focus on the workforce, help organizations adopt trauma-informed care into their policies and practices. So right now, oh, go ahead.
I was just going to say, what does that exactly look like? Tell me, like, if you're in a workplace that's participating, what that looks like.
Yeah, absolutely. So the first cohort won't start until the summer of next year. And so right now, Center for Children and Families is still developing the content. So they're basically creating a training module and we'll have this like Thrive at Work toolkit so that they can then have standardized learnings that organizations can say, hey, I want my workplace to be more trauma informed, more able to, meet the needs of the people we serve in a way that is safe and supportive to them. And they'll reach out to Center for Children and Families and say, hey, we want to do a training with our organization. And that's really a lot of, you know, what their focus is going to be. And let's see, I think I've added it in here. Yeah, for the first phase of trainings, it's going to be focused on human resource policies and practices, but it will continue to grow and develop out of that. But you could imagine taking trauma-informed care principles and both utilizing them and integrating them into internal policies. So, how do we treat each other and our staff? How do we ensure that we make psychologically safe workplaces? How do we ensure that we're not bringing bias into the way that we operate within our organization? So you can adopt those policies internally, and then it's, also important to then bring those out right into the people you serve and ensuring that those different trauma-informed care principles really are adopted internally and externally. So there's a lot of work happening right now to develop what the actual training content will be. And then this will actually be, oh, maybe it's back here, available for folks to, express interest in participating in. So we're excited to see that piloted. The long-term goal would be to have this available across the state, not just in the Northeast area. We also, so I'm, sure y'all are familiar with the LA Care Network. So this was previously the ACE Educator Program, but it's been rebranded to the Louisiana Childhood Adversity Resilience Education Network. Their goal really is to promote health education at no cost to those who are seeking out those trainings. So this is a similar kind of process where folks can request trainings through the LA Care Network. And because this is through the Bureau of Family Health, who is, directly involved with Whole Health Louisiana, we've been working really closely with them. We partnered with them for the 9 regional trainings that we did in year one. And we'll be continuing work with them again to advance awareness and advance training across the state. And this is really a network of volunteers, right? So our LA Care Network educators come from a wide variety of backgrounds. They might be community advocates, they might be service providers themselves in the space, and they cover a wide range of sectors as well. So it's not just education or just mental health, but really wide ranging to anyone in those child and family serving roles. So recently, again, the Care Network rebranded and they're more focused on ensuring their trainings are more actionable and solutions focused. So when someone goes to the training, they understand a little bit more strongly, okay, how can I take these learnings and actually start integrating them into my work? So there's a new module that was developed called Understanding Adversity, Building Resilience. And this is, started to be used as part of the training. So we had 18 educators trained on these materials in October, and then we're having additional educators trained on this for the rest of the 2025 year. And so once those volunteer educators are trained, this is then material that can be built into future programming. And again, if this is something, anyone's interested in their own work or organizations you know of, you can request these trainings for yourself, for your own organization. And you can email care@la.gov to get connected.
But they're not quite ready yet, right? That's what you're
No, they'll
developing.
still be training their educators through the end of the year. But it's they're able to really like tailor to what different groups need. So it's always worth some outreach. And it's coming soon. So I
Awesome.
getting on their radar would be fantastic if you're interested in it.
Great. No, we can forward that along to some people because that might be of great interest.
Yeah, absolutely. Our next piece I just wanted to touch on is our regional hubs. This is a new strategy that we are piloting now as part of year two implementation. We are looking to set up regional hubs that are across the state and can really get into, again, what I named in our mission, understanding community specific need. We don't necessarily want to say, here's the blanket solution for the entire state. We know that there's different needs in different areas. And we also know that there's work that's really great that's already happening in those areas. And so we were connected to the Capital Area Trauma Collaborative, which is a Baton Rouge specific collaborative that has a really similar mission to Whole Health Louisiana, just on a smaller scale. And so we are looking to, we're partnering with them as a pilot, and then we're looking to use that as a model to set up additional regional hubs across the state. And so what this really looks like is us identifying what groups or collaboratives or organizations exist out there who would want to be like official partners, official regional hubs with Whole Health Louisiana, so we can have really tailored communication and collaboration between the Whole Health Initiative as the statewide effort and kind of all of the tendrils of our hubs out in those community specific approaches.
Do you think it'll be before we get to a point where we've got really a good trauma-informed care network set up around the state that can, find that's set up to detect problems when they're happening and really come to the rescue?
Yeah, I mean, well, I'm really hopeful that it's full steam ahead with the Capital Area Trauma Collaborative. They also call themselves CAT-C. So we recently helped them put on a summit, which was kind of like their big kickoff to the community, saying, let's start our collaboration here. Let's validate some of the community needs that we see. And their next meeting is actually Friday this week, where they're confirming some of those big goals and starting to set up working groups that will actually be full of providers within their own community to start addressing what those community challenges are. And the same process was done with Judge David Matlock up in Shreveport a couple years ago. And that group set up working groups. They still meet. They've made a ton of progress, which was actually the inspiration for CATSI in Baton Rouge. So I'm really hopeful that CATSI's progress can really hit the ground running in 2026. And our goal as Whole Health Louisiana is from that model to develop a toolkit so that we can help other, again, collaboratives or organizations who want to be regional hubs do that same process and make the same progress that like a Shreveport or a Baton Rouge has started working on. So I'm hopeful that we'll have a couple regional hubs by the end of next year who have designated work groups who are actively pursuing strategies that their community is looking for.
So you're hoping to have the beginnings of that kind of by the end of next year, but then as it grows and develops, I mean, my guess, and trying to extrapolate a little bit from what you're saying is that really within 3 to 5 years, we ought to really have something that can really enable us to make a difference in our communities on a broad, like,
Yes,
well,
absolutely.
with a big foundation. Yeah.
Absolutely. Yeah. So the whole health plan, even though it's, a 5-year plan, and that's currently the funding we have secured is through the 5 years, but this is something that will not be finished as far as the long-term community impact in 5 years, right? That is a many, many years project. And so our goal is to set up these systems that can be self-sustaining even beyond the life of this dedicated plan. And so our hope is to really have a toolkit finalized in the spring of next year, and we'll have applications available that are open for other entities to say, hey, I want to be a regional hub. And Whole Health will support them in, ongoing collaboration. So we'll have, meetings with regional hubs. We'll support them in finding additional funding wherever we can. Um, we'll connect them to each other and share out the learnings with each other as well as the broader coalition. So I'm excited to see some good progress next year, but yes, it will. I don't imagine having necessarily all of the hubs, fully up and running in the next 12 months.
Right. No, for sure. The,
Yeah,
the beginnings of things starting to
exactly.
form.
Exactly.
Exactly.
Yeah.
Well, I appreciate that.
And so every area that you all represent, the goal and, ultimately will be to have each one have a regional hub. So y'all will be in the loop and kind of notified as that continues to be solidified.
Well, we're really looking forward to hearing more about that.
Yeah.
And really enjoyed your presentation, and it gives me lots of good hope for the future. Um,
Yes, absolutely. This is just things coming up, but y'all can scan that and see the website. This information will all be on there as well. But thank y'all so much for giving me some space and letting me go through so many slides. And
Can I ask
um,
a quick question?
yeah, please.
This is Kathy. I'm asking about the budget. Where does the budget come for Whole Health? Is it in the Department of Health?
Yeah.
And how much is it? What does it cover? And what does it look like for the future? I know that's a lot, but if you could.
Sure, yeah. So the allocated budget when we finalized the plan about 2 years ago was it was either 4.5 million or 5 million that was dedicated over the 5 years from LDH, from Louisiana Department of Health. So they are kind of, again, that public backbone and funder as of right now. They fund, Trepwise's support, Blanco Center as the implementation lead, and, additional activities that may come up. However, for this to really be a long-standing plan. That may sound like a big number. I'm sure y'all know we need more, right? And so that will be part of the implementation kind of moving forward. We'll be identifying additional funding and determining whether that is similarly like finding a big lump sum where this can go on for additional years and be kind of managed in a similar way, Or will this be setting up processes to ensure that everything we've established over the 5 years of the plan has methods and strategies for finding their own funding? And so we'll kind of be taking both approaches, but as of right now, the funding is through 2028, I want to say.
It might be a good time to transition over to Rebecca, and, to hear all about what she's here to talk about, from the child welfare perspective.
Thank you all so much for allowing me to come speak with you all today. And I can't think of an agency or a population that is more in need of Whole Health Louisiana than child welfare. But I was just saying there really isn't any population that I can think of, that is more in need than child welfare. So when we talk about child welfare, children in foster care alone in Louisiana, at any given point, like on any given day, we have approximately 4,300 children in care. And when we think about the children that enter our care over the course of a year, that can be as great as 7,000 to 8,000 children, because we do have kids that are coming in and then exiting care. But we also have to remember that there's many families that child welfare is involved with that remain in the home, and we provide those supportive services. When we talk about these families that we are seeing, children in child welfare involvement or foster care, 90% of those kids have experienced at least one traumatic event or traumatic exposure. And when we're talking about those numbers, that's very alarming, 90%. But then what's even more alarming to me is that almost half of those children have experienced 4 or more of those trauma exposures. And so this population is so in need of trauma-informed care, and also in need of providers to provide that care to these children and to the families as a whole. DCFS is very involved and supportive of Whole Health Louisiana. We have had multiple leadership members that have been involved from the first days in 2022, and then continuing involvement now. When we talk about that capital area trauma collaborative, David Matlock, at the time that started, was our secretary. He was the secretary of DCFS. And how it started was really organically. He realized, we're in the capital area. We have a population here that is in need of these services, but should really have the resources available, because we are the capital area. We should have, some of the most resources in the state for the population of folks that we have. And we really discovered that a lot of this was that the services were there, but there was not awareness of services. And there wasn't a way to bring those services to where they were needed most, to the communities that they were needed most in. And so that's how the collaborative really got started. I think it's going to continue to grow. Secretary Matlock is currently retired. Well, I actually heard that he's working as a judge again. I had heard that, but not working with us. But that mission lives on, and he supports that. We support that. We have a medical team now. And so it was just me in 2023 when I came, but there's now 3 of us. And so we plan to continue to support the capital area trauma collaborative, working with Whole Health, so that we have involvement there and can hopefully have that grow throughout our agency as well, because it really is going to be awareness in communities and community participation in these types of collaboratives and coalitions for this to be successful. If we don't have buy-in at the community level, then we're not going to be able to implement this across the state. And so, all of our DCFS team needs to really support that across the state. We're gonna aim for that. Something that Jaqueline did not speak about, but that I'm very excited about, and I hope really does come to fruition, is we have worked with Whole Health Louisiana and with LDH to implement an MOU and data sharing agreement. And what this is actually created for is so that we can have a longitudinal, comprehensive, population-based data set that is going to be able to look at some of the, preconception, antenatal, and early postpartum factors that are associated with these allegations of child maltreatment. And when are these allegations substantiated? When are children removed from the home? What are the factors that contribute to that? And so it's going to look across multiple different data components. It's going to look and be linked to the pregnancy risk assessment monitoring system, as well as our Louisiana hospital inpatient discharge data, our vital records, our records with DCFS, and then also the Louisiana violent death reporting system. So that's something that I'm very excited about. I hope that we're able to, really see this all the way through. If there are ever opportunities for us to collaborate across agencies, and funding, we always talk about funding, but if that is an issue, I think this is where dollars would be really well spent. And there are models like this in other states, such as Alaska. So Alaska has done some pretty great work with using this type of information across different systems to make some really data-informed decisions, like moving forward with what types of resources are needed. And ultimately, it could help us to really identify if there are certain areas of the state that need more of certain types of resources than are available, so we can direct our resources appropriately to where they're truly needed. Our population is, again, like one of the most vulnerable in the state. We are dealing with, very difficult situations for families. And so any way that our state agency can support an initiative like this, we're definitely going to want to do that. But I think it speaks to speaks volumes that we have seen buy-in from now. This is our third secretary, and DCFS is fully supporting these efforts. So, we really need to make sure our community is aware and that we are able to educate all of our stakeholders whenever we have that opportunity and take that approach as well. I don't have a lot of other information, but I'm hoping to answer some questions, and I'm sure you probably have some.
Well, one of the first questions that I've been kind of thinking of is, we know that there's some restructuring going on at DCFS, with the one door program, but child welfare's obviously still in DCFS. Has there been any impacts or any things to be of concern?
So one of the things that is really important to note is just that we have not lost any individuals from child welfare. So when that restructuring or reorganization did occur, they did not take any positions from child welfare. And what we're hoping is that this restructure is going to provide more child-focused care and involvement from the agency. Really make us focused on what we should be doing best, which is protecting our children and making sure that those most vulnerable have all the resources they need to have a successful and productive life in the future. So, I think that this could be really beneficial to the state for us to really support that child welfare, especially the front line. We're doing a little bit of restructuring internally in child welfare as well. And the goal for that is to push resources back to the front line, because we know that that's where the work is going to be the most crucial for us to be able to make sure that we're intervening with those families as timely as possible. But another thing that I've really seen with this restructure is an emphasis on the overall health and well-being of the population that we're serving. That is continuing to grow. When I started, it was just me back in 2023. Prior to that, there had not been any type of, medical involvement formally with DCFS. It was all through single case agreements, or if we had people involved with our MDTs across the community, but there was nothing formally in place. Now we have a nurse practitioner on my team that's working with me. And then we also have another nurse that was working in a different capacity for DCFS, but has come under that umbrella. And so we're really starting to look at things like, how are we using Medicaid funding? And are we making sure that our children are getting all of the behavioral health services that they need? We are trying to really directly work with the families and make sure that they have access to that care through their managed care organizations, and they know how to access that care, because that's another barrier that I'm sure Jaqueline could talk about as well. A lot of times it's that individuals don't even know that how to access. How do I make an appointment? How do I get a referral? how do I get this treatment covered for my child? And so our team is working on that a lot as well too. And I can see a lot of benefits for having some support to our families in any capacity, and we work at all levels. So child investigation, if they have family service involvement and they have questions for that, like our team is available for all of that as well to help coordinate community resources for those families.
Well, first I want to thank Jaqueline and Rebecca for joining us, but also just this crazily important work that you're doing. The future of our children is pretty much everything. And there's a lot of trauma and a lot of adversity in this world. And so helping people get through all of that and get ahead of it is of great value. We greatly appreciate it. Well, Jaqueline and Rebecca, thank you for sharing the time to meet with us today and offering insight into Whole Health Louisiana's future and its progress. And to everybody listening, we appreciate you being part of the conversation. We appreciate your engagement and just hope you have a great rest of your day. Thank you. If you're interested in these types of policy talks, check us out on Ellevate Louisiana's website, where you can learn more about our events, our policy committees, advocacy efforts, and how to join. That website is ellevatela.org, ELLEVATELA.org. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who needs to hear it.